aware that we are running out of time, and I will try my very best to limit what I'm going to say, but it's going to be very difficult for me. I am a professor of psychiatry working for the last 27 years in CMC Vellore, just a few kilometers away from where Udhavum Ullangal functions, has started a home. I consider myself an apprentice to Udhavum Ullangal because for so many years I worked as an academic. I had no clue about the needs of the homeless, and I had even less idea about what we need to do, what we could do for them. And it is only through working with this amazing group of people that I have actually learned something, and I stand here today because they have accepted me as an apprentice. I will talk about their work, the work of Udhavum Ullangal, from the unique perspective of a person who has been constrained, I call it constrained, by the dictates of science. I have fitted into a tertiary care referral center for the last so many years, and I then have had an opportunity to see what a group of people with absolutely no relevant training or professional accreditation have managed to do. And I am reminded of what Harsh Mandar said earlier about if you have the right attitude, if you are prepared to accept and show care and concern, anybody can achieve anything. So let me just talk about the home Prema has already told you about very briefly, but you've had a glimpse of what they do. Lacking rehab services, lacking an occupational therapist, lacking a social worker has not constrained them. Vandana, you talked about how they take residents along with them when they go to distribute free food to poor patients in the government hospital. But that's only one of the things they do. There was a blind, deaf person with mental retardation and psychosis who was rescued from the street. A few weeks after he was brought in, he became physically unwell, had to be admitted to this government hospital. In fact, it was not the nurse in the government hospital or the doctor who looked after this patient. It was one of the residents who stayed with this person day and night and cleaned him, washed him, bathed him, fed him. In fact, he said, I will bring him back alive. And he made a promise. He brought him back. He achieved his goal, and unfortunately then the man succumbed to his illness. But I'm saying, what more do we expect from rehabilitation when a person who was on the street has been enabled to reach such a level of mental health that he is able to care for somebody else? So the initiatives which they have created in this home and in other branches of Udhavum Ullangal, really something that I have learned from. I think our professional community stands to learn a lot. So in addition to the home in Tirupattur, they actually care for people with mental illness on the streets because they don't have access to a home into which they can admit these people. They actually go out, and I'll talk a little bit more, but this is a list of what else they do. On the streets, this group of people actually go out in maybe groups of 2 or 3 and visit each person with obvious mental illness sitting on the streets. In fact, this is how I got pulled into their activities. Mr. Chandrasekhar challenged me to do ward rounds on the streets. He says, you're going round and round the hospital every day. Why don't you come with me out on the streets? And we chose a 3-kilometer stretch of road and stopped to talk to each of the mentally ill people on the roadside. And we found out a lot. Unfortunately, there's no time to talk about that. But what Mr. Chandrasekhar and his volunteers do is to go out and offer people a meal, clothes, a change of clothes, the facility to have a bath. They will take them to a pay-and-use toilet facility and give them towel and soap and the services of a barber if they so wish, and give them a bath. And they have called dermatologists, psychiatrists out onto the street to see people right there, to deal with whatever cuts, wounds, bruises. There have been wounds which are pouring out maggots, which the person is eating, which they have attempted to actually dress. And it's only when they fail to give that first aid that they call us in. And it's a shame, it's a matter of shame for me that they have to call us in. You know, that's what our training does for us. We are so far removed from the situation of need that we need to be called in by somebody who doesn't have the training that we have. What else they do is, if the person on the street is so lucky, Ullangal will find them a place, not necessarily in a mental health facility, because the Department of Psychiatry, CMC Vellore, cannot admit destitute people. We don't admit anybody without an attender. Sometimes Mr. Chandrasekhar has actually found a woman who is willing to look after a destitute, mentally ill person while we are admitting, because there's no other way of managing their illness. But they find beds in old age homes. They have even arranged for a person to come to the Department of Psychiatry during the day, stay in our daycare center, take his medicines from us. We give him food, they give him other meals, which, you know, dinner may be provided by Udhavum. And they found a sheltered part of the pavement where this man can actually sleep in safety. And that's the best we can do. But that is better than what we are doing. We, I mean the professionals. What else they do is, once they have come into contact with a person with mental illness, as soon as they become well enough to be sent home, Mr. Chandrasekhar will find out whatever can be found out from the person who is mentally ill. And then if he has only the name of a town, he will ring up the BSNL operator and ask for 4 numbers from that town. And ring up each of those numbers, asking whether there is anybody conforming to that description who is missing from their area. And within 3 or 4 such phone calls, he has identified the home. Where the person is very, very ill, either they will be admitted to the Department of Psychiatry, or they will be taken to the home in Tirupattur, or we try to treat them, giving them medicines while they are in some old age home. Another way that Mr. Chandrasekhar has traced people is by looking at the label inside the shirt, the tailor, the address of the tailor who stitched that shirt. He contacts that area and finds the family from which this boy has run away. He's described how women who fought with their husbands run away from home and come to Udhavum. The first day that they come, they say they don't want to have anything to do with their husband. They will never go back home. So he says, we just listen to them. We give them food, we give them shelter, and we let them sleep. The second day, the woman who slept facing away from the direction of her husband's house comes and says, well, this is a telephone number. If you want, you can talk to them. But I will not talk to them. On the third day, she is willing to be taken home. Now, this is what I call using counseling techniques that actually work. He knows that you need to keep quiet, you need to listen, you need to support and allow the mind to heal. Who taught him this? Definitely not the Department of Psychiatry. We had a lady from the Congo who became mentally unwell while she was on a visit in India, and she was found absolutely naked and obviously mentally unwell in a surrounding near a village near the periphery of the Vellore town. The police, 108 ambulance actually picked this person up and brought her to the police, who redirected her to Mr. Chandrasekhar, because he is the person who takes care of all mentally ill people in Vellore. From that, we didn't know the language she spoke. We had no idea where she's coming from. He traced from the name of the hotel that she stayed in. She gave us the name of the hotel in Chennai that she stayed in. From there, he traced her passport, visa details, and her address, and finally coordinated her journey back to Congo. Other initiatives. They will accompany people on their journey back home. One young boy was found in Banyan, outside our hospital. He was treated and taken all the way back to his home in Nagpur by Udhavum Ullangal volunteer. They will provide money for travel if the person is able to travel by themselves. He has coordinated embassy and police to get a lady back to the Congo. He will receive and host family members if they are willing to come and pick up the relative who's gone missing. I don't even want to start on what Mr. Chandrasekhar and Ullangal do in terms of policy and planning in mental health. He has very definite ideas, and I think we would all benefit from listening to what he suggests should change in the admission procedure for mentally ill people. He is constantly raising awareness about the needs of the homeless mentally ill wherever he is given an opportunity. And in fact, just now, he's just received a phone call from somebody who's currently in jail, who's going to be released, and who they know no details about. So he wanted me to ask this audience as to whether somebody from Bengal can please help to trace this person's family. So this is how this organization cuts through everything that's peripheral and goes to the center of where we need to be focused. He has helped me to organize workshops in psychiatry for government doctors, primary health doctors, and he has spoken time and time again about the need to stop psychiatric medicines at the level of the primary health center. He has done capacity building. I am a convert. I have my perspective on the care of the mentally ill has changed completely, and I now work with them as far as CMC will allow me to work. So rounds on the street, bridging the gap between need and service, constant positive reinforcement for anything that you do, which is right. He will actually ring you up and tell you how much he admires you for having done what you have done. And these things make a difference, you know, and we are not teaching this in our classrooms. Since we have come into contact with Udhavum Ullangal, our postgraduate students, instead of just calling the security and getting homeless patients who may be left wandering in our hospital, getting them out of the campus, they actually sit down and talk to these people and find out where they may be coming from. At least think about where we can house them for the night, or where we can get a meal for them. And that is what I call capacity building. He runs a laughter club. He hires the town hall once a month and invites people off the streets to come and listen to people who tell jokes. And his philosophy is, why should we wait for people to become mentally ill before we give them our attention? Let us defuse stress. Let us allow people to laugh and forget their problems for a while, and we might prevent them from going into mental illness. He will hire a truck or a lorry and put as many young kids as who can fit into the lorry, buy them some sweets and send them for a picnic to Chennai, because the lorry is going there anyway. They'll bring them back. So these may be orphans, these may be physically disabled people, these may be mentally ill children, street children, whoever is willing. They, as a group, do not only help mentally ill. The help they give for the mentally ill is only part of a general push to help people in need. So, widows and single parents will get supply of dry provisions which are donated by other members of the community. If I were to summarize what I have learnt, what I think is the philosophy, I have not asked Mr. Chandrasekhar, and I am taking a liberty here, but this is what I feel is what they are all about. These are people